heart disease is this very large umbrella term that we use to describe a lot of different kinds of problems. And people can have, atherosclerotic cardiovascular disease, which is the most common, where we hear about people having plaques that form in their arteries and plaque rupture and heart attacks, but people can also have congenital heart disease, they can have arrhythmias, they can have valvular heart disease, so it really is a large spectrum of diseases. Atherosclerosis is the development of plaque inside your arteries that is usually driven by high levels of LDL or bad cholesterol. LDL is a waxy substance. This forms with other substances to create literally a plaque. Think of it like a speed bump almost on a road that's, blocking the artery. And when this plaque gets bigger, it really blocks blood flow. And that can be blood flow to your brain, to your heart, or to your legs or arms. Atherosclerotic cardiovascular disease is a process by where you develop heart problems, heart failure, or heart attacks because you have blockages in your heart that lead to poor blood flow and then ultimately cell death in your heart. And when heart cells die, you lose those heart cells forever and your heart doesn't function properly, and it can lead to heart failure or heart arrhythmias. In addition, having atherosclerotic heart disease can cause symptoms like chest pain, or angina is a term many people use to describe the lack of blood flow to the heart and the pain that ensues afterwards. For patients who have untreated atherosclerotic heart disease, the plaque will progress and they can develop either chronic, more silent type of process where they're not realizing that they're not getting enough blood flow for a long period of time, and then by the time they realize it's too late and they've developed a heart failure syndrome. Or they can have an acute emergency type of episode like a stroke or a heart attack when one of these plaques ruptures and causes acute lack of blood flow to the heart or brain. For atherosclerotic heart disease, we really want to treat the multiple different risk factors that patients have. So we will treat diabetes, high blood pressure, high cholesterol. We will recommend smoking cessation. We recommend aerobic brisk exercise, weight loss, loss of a sedentary lifestyle, and a Mediterranean type diet. In addition, some people will require medication, and that medication may include a baby aspirin, it may include a statin, and it may include other class of drugs known as beta blockers to help prevent progression to more significant cardiovascular disease. Because atherosclerotic heart disease can be treated so effectively, it's crucial that we start screening people from a young age and intervene early. Many people in their 20s and 30s don't want to think about high cholesterol, but if you have it and you can treat it, then your risk of a heart attack and a stroke is so dramatically reduced later in life that it's really crucial for people to do it.